And she came on stage and she said, I've been here for 5 weeks and I saw every speaker and it's super interesting. And I love this functional medicine approach. She said, but in Chinese medicine, we've had this for a very long time. So welcome. It's about time you're here. So I was like, wow, it's kind of true because it does look at the whole person, the whole picture. If you've ever been to a traditional Chinese medicine doctor, it's not just you got a vitamin B deficiency, here's a supplement. They do ask you a lot of questions. All right. So welcome. It's a real pleasure to have Dr. Indra Barathan on the show today. Welcome.
Hi, Dora. How are you doing? I'm so excited to be here. Excited to share more information with your wonderful community. So I'm doing well.
I'm so excited. I can't believe it took me this long to get you on the podcast. Honestly, this has been a long overdue because we met, I think much earlier this year through, even before that, through a WhatsApp group of biohacking women and women in the health and medicine, functional medicine space. And you and I connected and I wanted to learn more about you because you were in the UK and I thought, well, I got a lot of people listening too who are in the UK and they could use some of your functional medicine advice. And we had a chat and I got to see where your positioning was to see if we're in alignment, and it was. And then we got you into our Biohacking Menopause membership group every month to share so much about menopause and hormones, and you're a real expert on gut health, and you've been getting to know our community and the ladies in there and giving some really great information because you come every month, you get to know these ladies and some of their issues, and it's really nice to see them evolve and take on your advice. So I'm really glad to have you on finally. It just took me forever to get you on, but you are here. So why don't you tell us a little bit about your background too, how you got into the functional medicine space and kind of what is functional medicine anyways?
So I started off my career as a general practitioner here in the UK, and we all go into this health sector because of some drawing, some kind of heart-centered need to support people, that kind of thing. And that's why general practice really resonated with me, just because you could see the whole person and you were dealing with more than just their symptoms and conditions. And I absolutely loved doing what I was doing. But probably about 10 years ago, things started to change for me. And the pressure and the ability to really not have the time for patients and the complexity of what we were seeing really didn't stop resonating with me. And I remember sitting in a diabetes clinic that I was running at that time. And the patient came in, his blood tests were still abnormal. And I was saying to him, right, the next tablet that you need to have is this other tablet. And actually, this tablet may cause you to have urinary symptoms and it may cause you to have thrush. So I'm going to have to give you another medication to deal with that medication. And I kind of sat there and thought, what am I doing? What is going on with this patient? And I sort of asked this question intuitively, kind of, what does diabetes mean to you? And he was like, what? Nothing? Like it didn't connect with him at all. He was just doing what he'd been told to do. And then from there, it went on. And I just realized that there was something missing in how I was practicing medicine. And I went through my own burnout with a lot of things that were going on at the practice. And my friend told me, she goes, Indra, there's this way of working that people are actually getting better. And I was like, really? Like, why didn't we know about this? She was in Australia and she had worked with the Australian College of Environmental and Nutritional Medicine. And she's like, yeah, people are talking about nutrition and supplements and really digging deeper into the patient. And I was like, okay. I was like, what are you talking about? There's nothing like that here. None of our people are talking about that. So I just started to explore it because it really triggered my curiosity as to what is this and why are people getting better? Because generally speaking, people just keep coming back and they didn't get any better. My depressed patients just were on more medication. my diabetes patients with more medication, people with chronic pain. I was really running out of what else I could do for them. And I mean, at that time, menopause wasn't like as big, but just even that sort of hormonal health, we really had very limited things. And then there was a whole thing about HRT and whether or not we should be giving it. All of that was happening all around that time. So I started to explore it, and I went to my first course and it blew my mind. I was like, oh. And that's how I've come to really realize that functional medicine is about understanding the root cause, understanding what is involved in that human being presenting with the symptoms that it's presenting with. So it's not necessarily about diagnoses and what do you do with a particular diagnosis. It's about understanding how is that particular symptom coming through and what functionality of your body is not working as optimally to allow you to have that symptom.
Yes, it's people would say generally traditional medicine is they treat the symptoms. I mean, or just, I don't know, the medicine that we all allopathic medicine. And then functional medicine would treat the root cause of a disease. So you're actually getting to the problem so that it doesn't recur. You don't keep getting the symptoms. And what I'm hearing from you is you're saying, well, yeah, your symptoms are a sign that something's not right in the body. And so, yes, that's kind of what it seems to me you are practicing. Let's just mask the symptoms. Let's just get the symptoms to go away. And now you're saying, all right, let's dig a little deeper. So then you need more time. That's what a functional medicine doctor, in my understanding, does, is spend the time with you to look at the whole body, not just my throat hurts and let's just go to your throat, or let's look at other things. So maybe you want to explain a little bit what root cause actually means to you.
I think the reason I think this is a really important question, is that part of this kind of new world of health where people are looking at the latest supplement or the latest technology or the latest something that's coming up that seems to be helping people feel better in themselves, people are still not necessarily understanding what is the underlying root cause. For example, let's say somebody has fatigue, which is a very common symptom that we see. Conventional medicine might look at it and might do a blood test and might find that there's an iron deficiency or a B12 deficiency. Or they might not even find anything because they're not necessarily looking at the blood tests in the way that we would look at a test, instead of looking at vitality and optimal health going forward. So let's take that. In functional medicine, we might go, oh, actually, it's B12 deficiency. Oh, great. That's not been picked out. Great. Let's give you some B12 and you're sorted. But really what I mean by root cause is, why is there a B12 deficiency? And then when you go into B12 deficiencies, you then start to ask, well, is it about absorption? And then if you think about absorption of B12, you look at the gut. And then you start looking at the gut and you think, well, why is the gut not absorbing the B12? Is it about nutrition? What is going on with the nutrition? Have they made changes? How are they eating? What's going on there? Or is it because there's some kind of interaction with some kind of medication? So you see, we're not just stopping with you have a B12 deficiency, which conventional medicine didn't pick up because their ranges are bigger than what we would want it to be. We're actually diving deeper to go, well, why are you deficient in B12? And what is stopping it? And maybe there's genetics there. All of these things, it's about getting to the root cause. And I think for me, the functional medicine model that I use, where we start at birth and work all the way through your history until whatever point we are seeing you, allows us to develop an understanding of how your body is working. There are signs and symptoms that have been appearing for you all the way through your life that give us an indication of, is your absorption not so great? Is there been something going on with your gut? Have you not been eating enough nutrients in your system? Has there been some kind of stress or trauma that's been affecting how your body's working? Has there been some toxins that you may be in an environment that may be affecting how you do it. So all of these things allow us to really develop at the first consultation potential root causes. And what I'm finding is that when people understand, oh, that's how I got here, they can then rest. They're not constantly searching for the next supplement or the next thing because they go, this is how my body's working. For me, that's the essence of root cause, going that much deeper, but also allowing you to understand how your body's working, because each of us is very different. Each of us, one person might have had antibiotics and it caused this. One person might have had antibiotics and it caused something else. It's understanding what is going on with you. So it's a bit of a long-winded idea, but do you see what I mean? It's really diving that little bit deeper so that you understand you and how this then allows you to interact with the world around you.
That's a really great explanation. It goes much deeper than I think what most people think is functional medicine. So I'm glad I asked that question. So I thought I knew, but it is so much more. And it sounds very much like I did a conference in Hong Kong when I was living there, and I think it was maybe 2017. It was a 5-week conference, and I gathered all the experts in the area to speak about one pillar of longevity, because I was doing a lot of longevity stuff there. The first one was about sleep, and the next was nutrition and stress and all that. And the last one actually was not a necessary pillar, but I wanted to cover it. It was beauty. And so I left it for a Chinese medicine doctor who had some very interesting and different techniques. And she came on stage and she said, I've been here for 5 weeks and I saw every speaker and it's super interesting. And I love this functional medicine approach. She said, but in Chinese medicine, we've had this for a very long time. So welcome. It's about time you're here. I was like, wow, it's kind of true, because it does look at the whole person, the whole picture. If you've ever been to a traditional Chinese medicine doctor, it's not just you got a vitamin B deficiency, here's a supplement. They do ask you a lot of questions. So it's almost like functional medicine's come full circle, or at least we've put the science to it. And that's, I think, was one of her points, was like, yeah, we've been doing this for a long time, but now I guess you need a lab coat and you need some science. So there, it's proven. So that's what I think people need. They need a bit more time rather than, and that's the difference as well, is that they get to spend more time with the doctor, because it's not in a 15-minute session that you're going to be able to answer their questions. So that takes a while, right?
No, exactly. And I think you were saying about Chinese medicine, but Ayurvedic medicine has been doing the same thing as well. So a lot of the Eastern medicines have been looking at the whole picture and the kind of mental, emotional, spiritual health of our person as well. I don't remember the numbers, but I think Ayurvedic medicine has been around a lot longer than Chinese medicine. Is that true? Are we talking like thousands of years, aren't we? We're not talking.
Yeah, one's like 3,000 and the other one's like 5,000 or something.
Yeah.
I was surprised, as I thought, Chinese medicine's been around. But when I first heard this, I was like, okay, Ayurvedic's been around a little bit longer.
Exactly. Definitely.
So then what would you say is your definition of health?
My definition of health is a sense of calm, a deep breath, presence, and feeling vital. It's a combination of all of those things. And when you look at the WHO definition, it's about not lack of symptoms, overall mental, emotional, physical, social, financial well-being. I think if we can be present in this moment, take a deep breath and just go, in that moment, we have health.
We covered this a little bit in gerontology, where we had looked at different definitions of what health can be. And the general definition was just being free of disease. But then that excludes, it doesn't take into consideration the fact of just being happy too, unless you have a completely different goal. Because when you think about, well, what if you're born with a handicap? okay, it's unhealthy, but can you live a very healthy, happy life? Or certainly you can. So you're already excluding some groups of people that actually can fit a different definition of health, be perfectly healthy with certain diseases or certain issues. So I think your definition is really spot on. It's really good. And I think for me, generally, I if I could just be happy and be happy more days than none, then I think I'm doing okay.
It's those words, isn't it? Happiness and contentment.
Yes.
Finding that in what we're doing. And in our clinic, even with the people that are coming to us with lots of different symptoms and diagnoses and stuff, we're always asking them, where is that? Because that's still present. And if we can find that for you or help you find that, you tend to find that symptoms tend to drop away.
Crazy, huh?
And that's the little bit that I have no science behind it, but that's what we're seeing. If we can get people to just let go and just kind of, okay, where's my happiness and where's my contentment?
Yes, because it may be a long road to healing your disease. And if you could find some happiness along the road, it makes it a lot easier. And this is what the journey that I'm going through right now with osteoarthritis of my hips. And you think, well, now I got to get a second one. So it's like, I better make this a really good time, because again, it's going to be a long while for me to be happy. If I'm going to say, oh, when I got full range of motion, I will be happy. No, I think and I don't want to wait. I just want to be happy now. And I'm sure that just makes the journey much easier, because I don't like the alternative. It's no fun. And I don't think it helps me either anyways to heal.
I think happiness is one of those things that I've done a lot of work for myself to understand where that comes from, and kind of which pair of glasses you decide to put on in the morning really affects how you view the world around you. And as you're right, if you've still got a pain here, or you've still got whatever's going on with your body, but you're able to find some spark of joy or peace or calm, or even just a beautiful deep breath, your body is then being sent a signal that it's okay to heal. Yeah. And that's key to healing, isn't it?
It is, but I can tell you it's not easy. It's not. You are in chronic pain. I get it. You got to dig real deep. And I'm generally a positive person, so I'm sure it's much easier for me than someone who isn't. And it's already hard enough. So it's something that I think it is worth investing your time to be happy. So let's move on a little bit to what your clinical experience is teaching you and what you're seeing when you are, let's take the menopausal woman, for example. Okay. This is a woman in her 40s and 50s. What are you seeing? What are her biggest complaints? And then what are you finding is the root cause of that issue?
I think when we're thinking about perimenopause and menopause, literally anything and everything is a symptom. So when I was thinking about this, I was like, what are the symptoms? That you could literally start from the top and make your way down the body. Because in the end, all the hormones are literally affecting the whole body, isn't it? So you've got some simple things like brain fog, anxiety, depression, headaches, sinus issues, immune system issues like congestion. It could even be palpitations. It could be breathlessness. It could be gut issues, literally the whole thing. Joint issues, obviously all the gynecological kind of issues like dryness down below, libido, those kind of things. But literally from head to toe, we're seeing everyone. Probably the most commonest symptom we're seeing are two things. One is this kind of loss of self. The people are sort of saying to us, I just don't feel me anymore. And the second thing is probably fatigue. Those are like the top things that we are seeing in our clinic. And then as we go upstream, like we went upstream with like B12 deficiencies, So let's think, okay, so something like fatigue, that we look at nutritional deficiencies, and a lot of women have nutritional deficiencies. It could be vitamin D, it could be the B vitamins, it could be a number of things. Then we just go further upstream and we think, okay, so why have they got nutritional deficiencies? Then we're just thinking about the gut and go, well, are they not absorbing what's going on there? And then we just think, okay, are they not eating it because they're so busy, they're so whatever, that they're not actually thinking about it? And then we go further upstream from that. So if we're thinking about the gut, which I know we're going to talk a little bit more about, then we just see, okay, so there is some kind of leakiness going on. And then we go further upstream, say for nutritional deficiencies as well, go, why is the body utilizing it? Like, say if they're eating a really normal diet, why is the body utilizing it? And for me, the most upstream of all of this, if you've seen how I've gone upstream, is stress.
The big one.
And everybody in our sort of, when we're assessing the patient, we're looking at all of those things. How do we absorb? How is your immune system working? How do you detoxify? How do you create energy? How does your hormones work? What is your structural integrity? How is your heart working? In the middle of all of those things is your mental, emotional, and spiritual health. And if people are not ready to go there, we struggle to take that next step with them.
I think most people are not ready to go there. That's the pain. That's where trauma lies. That's where all the issues. So we leave that to the end. Like, what supplement can we take? What therapy can we do? But the emotional, mental, and spiritual, forget it. I think it's hard work. And I'm 100% agree with you. And this is something that I started exploring when I tried every treatment, every supplement, every medicine, everything I could for my hips. I was like, you know what? Maybe I'm going to go down deep. There's some trauma in there. And I said, whether there is or isn't, it's probably a good thing that I practice some of these things like journaling or go seeing a therapist or try to dig a little deeper and using my voice, or I tried everything. I mean, I really tried everything. So that didn't quite manifest, but I think, or maybe I didn't get far enough. I don't know. I mean, I tried, but doesn't mean that that wasn't maybe the root cause of my osteoarthritis. I mean, or could be a contributing factor for sure. And there comes a point though that you think, well, the reason I get the operation is because I ran out of time and money. Like, I don't have time to to dig deeper. It's like I'm in so much pain. I really want to, and I had no more money left. So you go, well, let's take care of this. There comes a point where sometimes you just have to go. But I would still say, just because I tried doesn't mean, and I think, oh, I don't just tick that box off and say it didn't work. I would still go back because I think I still have a good chunk of my life left, and there's still chances of getting disease because of stress or trauma or something that you haven't dealt with emotionally, mentally, or spiritually. So it's just the one that I've have coaching my clients as well, and whenever we go there, it's always the last piece because no one ever wants to do it. And then, of course, you need some good therapists, or you need good contacts and all this stuff too, as well, to try to direct people in the right direction, because they don't know where do I even start to work on my emotional, mental, and spiritual. So, what would you recommend to your patients when you go, oh, this is got to be taken care of?
And I think that's the key thing that you just said there that I really want to focus on. There isn't one root cause. It's always a combination of things. And when you've done the history and you've analyzed it the way that we analyze it, we end up with the top 3 things that are affecting you. Whether it is the sympathetic overdrive and the stress, how that is impacting on your immune system, and then that's how it's impacting on your gut. When you have your personalized root causes, you could then make a decision which out of those ones you're going to start with. And then dive deeper. I mean, in terms of things relating to understanding the impact of stress, part of it is just acknowledging that it's there and actually acknowledging that that could be part of it. Because if you are like, no, then that is a resistance to what your body is telling you.
Mm-hmm.
And so for me, it's about really working with the person sitting in front of me to see where are they ready? What are they ready? Are they ready for some breath work? Are they ready for diving that much deeper? Are they ready for tapping? Are they ready for coaching? Where are you at with this? And if you're not, that's okay as well. Let's look at the symptoms that the stress is showing out for you. So maybe you have palpitations. Right. Okay. You have palpitation. How do we support the palpitations? That will automatically deal with the stress.
I see.
What I mean?
Yeah. It's all connected.
Connected up together. So maybe your stress is actually affecting your sleep. So, okay, let's focus on your sleep. That sometimes is a way in to actually what that root cause is. And people get it. I was like, I can't sleep. Okay, what are we going to do about that? That's the kind of thing that I might say to them. Let's journal. Let's do a brain dump before you go to bed. If you're like overthinking before you go to bed, then it connects them to why they're doing that piece of work. If you're having palpitations, let's do some breath work to help you just slow that down a little bit. Maybe you use a Sensate, some kind of device to slow it down. You may not understand that you're working on the stress, but you're helping with what they can physically see, if that's how the stress is manifesting itself. If you're overthinking, what can we do about overthinking? Can we help you to understand where those thoughts are coming from? How are you creating your reality? Can we explain that to you? Does the vagus nerve make any sense to you? So we kind of go with where the patient is. We're not going to go with, you know what, you need EMDR and like in-depth trauma counseling, because they may not be ready for that level of it. So it's about gentle and slow and taking small steps towards whatever's needed for the person who's sitting. I mean, I had one lady that has got a very severe histamine response at the moment where she's just reacting to everything. She's perimenopausal as well. So it's kind of really flared everything out. But she's so sensitive, I can't even give her a supplement at the moment because she's reacting to every single supplement.
I know those people. I know it's hard to work with those. It's very hard.
So for me, I have had to just be really clear with her that until that vagus nerve and that kind of stress response is down-regulated, me or any other practitioner is not going to be able to do anything.
Yeah.
And she has to kind of find that. And she's slowly getting it, but we're doing very small things with her.
Because sometimes these things have been around for 20 years. I've met with people. So how do you help that person after 20 years of not understanding and not being able to regulate the vagus nerve and relax and de-stress? Like you said, baby steps, like what's one step, for example, you take?
We have a pharmacist on our team who's also an Ayurvedic practitioner. And one of the things that we found with a lot of the women that we work with, we really don't know how to rest. We're in this, but like 100 miles an hour. And you're like, what does rest even mean? And we're seeing that a lot of these women are also, there's a sort of an ADHD component that's coming through as well. And that makes it even more that they're like, woo, 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 all over the kind of, that's how their brain works. So we're like, well, we can't just get them to stop because that doesn't make any sense for them to do. So he has a yoga practice that he does with them that actually speeds up their movement.
Oh.
And that helps them to relax. It's a kind of a reverse of what you'd expect it to do. So he makes them kind of do more movement. And while they're moving, he's getting them to kind of get into that space of contentment.
Interesting. That reminds me, because when I would say my 30s, I was always trying yoga. And I was like, because everybody says yoga's good, but I needed to sweat. And I was like on fire. And I just, once a year I would try and I'm like, nope, still don't like it. and then one day I did meet a yoga teacher. And that day, I think I was ready for it and I met the right teacher. But I think if I met that person in my 30s who just sped it up for me, I probably would have hung on. And I get that because everything about kids and babies and life and after school and all that stuff, it just doesn't stop. So I think it's actually a great technique that I never really thought of.
Because we've had a lot of women come through with this. He's been kind of helping them kind of do that to support them actually finding that little bit of quiet in what they're doing. And it seems to be working, but we'll come back to you. It's
yeah, so great. Really interesting. So, all right, let's get into the gut. Is there a hormone menopause gut connection?
Yes.
Okay. All right. So let's hear about it, because I'm sure the gut changes as a woman is going through this transition. So what's going on with all this triad?
I think the thing that we have to understand is the gut is your interface with the world around you. And the interface with the world around you is only 1 cell thick. Like, that's the barrier to the world around you. And the gut has receptors for all the hormones, because the hormones are interpreting the world around you and telling the body, am I ready to digest? Am I ready to heal? Or is it time to run away from the saber-toothed tiger? That's literally the 2 things that's happening for that. So when we're thinking about the fact of how menopause or the hormones affect the gut, we must understand that every single part of the gut has receptors. So every single part is going to be affected when the hormones start to change. And I think for me, when I was looking this up, because you were asking about gut, and I was like, right, I know it does, but I want some data behind what is actually happening. And it was really interesting. I kind of researched a little bit about what the changes are. So there's so many things. So change the gut microbiome. Apparently, estrogen actually affects the gut microbiome. So those are the bacteria in the gut, because we know that estrogen is metabolized and processed by the microbiome. So there's actually something called estrobolome or something. It's like
estrobolome, yes.
Estrobolome. So we know that when the hormones change, that also changes. So how estrogen is processed and recycled in the body is affected. So it changes the gut microbiome. Estrogen also affects the gut barrier. So there's been some research to say that actually it makes the gut barrier a little bit more leaky.
When we lose our estrogen, you're saying.
As the estrogen changes, as it drops. And obviously, when you have the hormones that are changing as you go through menopause, obviously, we have the adrenal hormones, we have all the appetite hormones, we have the thyroid hormones, as well as the female hormones. And there are loads of other ones, but, those are the things, and the insulin as well. So all of this is affecting. And that also impacts on appetite and motility of the gut. So how the gut moves, how you feel, and how your appetite also changes with the changes relating to menopause as well. Then it also impacts on the absorption, because all of the things that we've just been talking about, and you get more of a leaky gut, your ability to absorb nutrients is affected. This then impacts on your calcium and all the other nutrients that you need for your bone strength, as well as everything else that estrogen is doing to your bone strength. Then, if you've also got a leaky gut, it stimulates your immune system and you get increased inflammation. And we now know, I think I was listening to a talk, estrogen is actually part of all our immune cells as well. And how our immune cells are our defense system, like our soldiers in our body. So that also changes with the change in estrogen. It impacts our acid production, and also the stress itself then impacts the gut, because we're now not feeling so great. So literally everything.
It's crazy. It's nuts. And honestly, it seems so unfair. Like we lose our hormones and then everything gets out of whack. So you would think, because I don't know, what is it? 80% of the immune system is in the gut, or some high number like that. Yeah. So you would think then we would be getting a lot more sick during this transition because we'd be more vulnerable, right? You're not making the bacteria and the strobilome is being affected. And now everything is, I guess the gut, it always comes back to the gut. But would you say that women are just getting more cold or just getting more sick? Or is it just all kinds of diseases they're getting because of that, because of the gut?
Because of the gut, we have to ask the question, why? What's changed with the women that means that this transition seems to expose the gut symptoms? And I think what we're seeing is how people are arriving at this point. I don't think we're arriving as well as we could arrive. So we've already got gut issues. We've already got leaky gut. We've already got inflammation. We've already got stress and the impact on all of that. And then we have the hormones that change with it. So I think it's more about how we've arrived here and the fact that a lot more of us are far more unwell. And I was saying this to one of lots of people. When I started out as a GP 20 odd years ago, we generally used to see people in their 60s and 70s, and then some of the kids with like your sore throats and those kind of things. The middle group, that sort of 20 to 50-year-olds, we hardly saw them. You may have a few people with some chronic things, but nothing much. But now, before I left standard general practice, majority of the people I was seeing were kids with chronic illnesses, on regular medication, all of these kind of things. And that population, that 30 to 50 population, medication, polymedication, like polypharmacy, before they've even got to the point where they're past the menopause. So I just kind of wonder how we've got to this point, and why is it that we've got a chronically sick community?
Yeah, and it's
a bigger question, but
that's getting worse. That's what you're saying, is that you hardly saw these people, and then suddenly they're all here. And why? Some people would say it's the food environment. Other people would say it's the stress or the gut, or why the gut. I think if you look back in history, we're at a time of less stress than we were before. I mean, when we had wars and we lived on the streets and we had to build fires and we were worried about saber-toothed tigers and danger. And when you think we're relatively at peace, even though it doesn't sound that way, there are wars happening all over the world. It's one of the most quiet times in history, but yet we have so much stress. Is it the media? Is it, I don't know. I don't have the answers, but there's something going on where people, and are they getting sicker, or is it just they have more access to doctors? Again, this is a whole can of worms we could open up, but it is a question to think about. And all you're saying is, I don't know why, but I'm seeing a lot more people.
Okay. And I'm seeing a lot more people. And I think we need to sort of, when we're asking the question, is kind of seeing, how did you get to this point? None of us arrive at menopause and then suddenly it all happens.
Yes.
It won't happen like that. It has been signals, or as I call them, love letters, that have been there that make you more likely to have more problems in menopause.
Interesting. So when you see a woman who is in her 70s and 80s, what's her gut issues like relative to someone who's in that perimenopause transition?
There's a lot of sort of acid reflux type issues, but then generally we know that your acid production does change around that kind of time. A lot more issues with kind of constipation, those type of symptoms. And then obviously more sort of, you were speaking about anatomical things like your hip. Anatomical things we can't change. If you've had a prolapse or something like that, that is what's happened. It is what it is. So we see a lot of more structural issues going on with older women, but it tends to be, I'm just thinking back to the ones that I've seen in the 70s, a lot of acid issues, a lot of stress issues that is then affecting this as well, if they've got gut issues going forward.
You mentioned leaky gut. Let's define that. What is leaky gut?
So the leaky gut for me is increased gut permeability, that word permeability. So the analogy that I like to give is like a sieve. Your gut is like a sieve, and it's making sure that you're not absorbing your toxins and foods and bacteria that it shouldn't be absorbing it. So your sieve is really nice and clear like this, and it's making sure it keeps all the toxins out and all the bacteria out. But when it becomes leaky, it becomes bigger. So the sieve holes become bigger, and things that shouldn't have got through get through. And as you just mentioned, that 80% of your immune system is here, your immune system looks at it and goes, what? What's this? I don't know what this is. It then starts to create a response to it. And then we start to get something called inflammation or fire or whatever we want to call that word. It's that immune system defending itself against things that it doesn't really know what it is.
So what are the symptoms of leaky gut?
It's very variable from person to person, but it could be as simple as acid reflux. It could be gut symptoms like diarrhea or constipation. It's very varied, but it could be even brain kind of symptoms like anxiety, mood changes, those kind of things, because the whole barrier is the same barrier everywhere. So if the gut is leaky, you tend to get leaky brain as well. And then you get symptoms relating to that. So every single symptom that I described just now probably comes from a leaky gut, because that's where your immune system is being triggered.
So that's why it's so important to take care of the gut, because I think a lot of people in general will be like, acid reflux, or I just take this pill, and they think it's normal. They think it's aging, whatever. They just go on with their lives. So what happens to this person if they ignore their gut issues?
This is a really interesting question, because what I mentioned before, love letters, when we take our history, people have had issues with their gut, even as a baby, even as a teenager. They've been either having diarrhea or constipation. And we don't really talk about how we poo, if I'm going to use that word, because that tells us a lot about how our gut is functioning. And we've normalized a lot of it. And actually what that tells us is that if we keep going with it, eventually you are going to get some kind of chronic illness, because your immune system is upregulated. It's not like if you heal your gut, that's it, because there's going to be times when it gets better and then it gets worse again. And that's the way the body is doing what it needs to do. But when it gets better, you tend to find that you have less inflammation, less symptoms, less mood disorders. All the chronic diseases seem to get better as we start to heal the gut.
So what are your 3 methods of healing a leaky gut?
So 3 methods. We have to think about nutrition. Nutrition is so key for this, because, and this is so interesting, I didn't even realize why I hadn't even thought about nutrition when I was in GP, but our body is this amazing machine. It needs nutrients to do everything we're wanting it to do. How does it create energy? It needs like 21 different nutrients for it to create energy. And if we are not even thinking about making sure we've got the basics, how are we going to even allow the gut to work effectively? And obviously absorb and things. So things like fiber are so important for the gut. When you ask a number of our patients, most of our patients are not eating more than about 3 vegetables a day.
Wow, not me.
We're needing to be at the 9 or 10 kind of range. So we're pretty much just about trying 3 fruit and vegetables a day. So fiber is so key. So anything relating to nutrition to really give the gut what it needs, and the bacteria in the gut to kind of allow it to do the job that it needs to do. If it's been disrupted, then there's a little bit more work that we need to do. And maybe we're looking at things like probiotics or prebiotics or things like that to kind of help.
Yeah. And some women are, as I work with, which just can't eat a thing. It's just like a vegetable will make them just have stabbing pain or diarrhea, or they're afraid of the vegetables or fruit. And because it's so affected. So would you start with somebody who's really sensitive, I guess, to get more fiber?
To get more fiber, I think we've got to understand where that sensitivity is coming from. And our nutritional therapist in our team very much starts by understanding the whole environment of digestion. Environment of digestion is you looking at the food, you taking a breath before you eat, and making sure that your environment is not stressful for you, taking time out to do that. So she works a lot with sort of breath work before eating as well. And also the psychology behind eating. When you've been ill for so long, you've got a connection with the food that you're eating, and that even before it even enters you, you've already got a fear of it. So that's why we work with our psychotherapist as well to kind of understand, well, what's going on. So because we have this multidisciplinary team, the patient is getting support from lots of different angles. And what we're seeing is that slowly diversity then starts to happen with them. I mean, there needs to be probably some supplements in terms of sort of gut healing and supporting things like magnesium, all of those key nutrients that a lot of us are deficient in, that helps us just to feel a little bit calmer as well. So nutrition is number one. Number two is breathwork and finding calm.
Yeah.
And that had to be there. If the reason I went for nutrition first is because stress is the hardest thing to do. So let's pick on something that we can probably work on and see what we can do, and then go into breathwork. And I think the third thing is movement.
That's a good one too. I love all of these. These are fabulous hacks. So is there a movement in particular, fast, slow, or yoga versus running? Anything in particular that's better for the gut?
I think personally, it's what suits you. What is it that's going to make you feel joy? I love the work that Daryl Edwards does. I'm sure you know Daryl Edwards. If movement is play, it releases much better hormones for you. So if you're running on a treadmill and you feel like it's not going to be helpful for you, but if you're like swimming the sea or just running in the beach or doing some downward dogs or becoming an animal or whatever it is that makes you feel great, it's already going to be allowing you to feel so much better in yourself.
These are great tips. Oh, I hope everybody's been writing these things down. I'm going to have to let you go, but I'm so happy you gave us such great tips and explained what functional medicine really is and covered the gut pretty well. I would love for people to know more about you. So I'll have a link to your website, drindra.co.uk. I'll have your Instagram and your email as well. And you have a couple of things that you can offer in terms of exploring with an appointment. What is that? How does that work in your vitality health screening?
The vitality health screening is an in-person one. So if you're in the UK, then you can definitely come and visit us. It's an amazing in-person testing, which allows you to look at 50 or 60 different markers just in half an hour. And it tells you how your whole body is working. And it's really great. And then we use that as a way of sort of supporting people and then them coming back and seeing that the changes are actually affecting them. It looks at digestion. It looks at stress. It looks at oxygen saturations. It looks at BIA, looks at the whole body. It's such an amazing in-person test. And it's so quick and so easy to repeat. And what we're seeing is that patients are actually getting the data to look, actually, this isn't there. 6 to 8 weeks later, they're coming back, they're getting retested, and they're seeing that actually it's working. And it's an easy way to track what's going on.
The data, because sometimes we should feel better, but sometimes we don't notice these things. That's why I take pictures of my wrinkles before I use a skincare, because I forget the progress may be so slow. So you're in Birmingham, or where are you?
We're in Leeds.
Oh, in Leeds, yeah.
Yeah. And we have now a clinic in Wetherby, which is a little bit north. And we hopefully will be opening a clinic in London in January.
Oh, fabulous. Great. Well, I'll have a link to that in the show notes. And before I let you go, is there anything else that you would like to share?
I just want people to just take a breath and just keep listening to that inner voice. You have the answers within you. Sometimes we can get overloaded with information, and that in itself becomes too much. But just be quiet, take a breath and listen to your inner voice, because what's needed for you will unfold for you.
Oh, I love it. Thank you so much. I'm super excited. I will see you next week in our Biohacking Menopause group. Thank you so much for your time and have a wonderful evening.
Thank you so much, Laura. Take care.